So a lot of your work is obviously advocating for equity amongst people from different places, right? You're yourself Colombian, and there's obviously discrepancies in terms of knowledge from, as you mentioned, in those Facebook groups between, say, someone in North America versus someone's, like you had mentioned, Colombia, in terms of knowledge of genomics. How do you think about health equity in your work, or as a patient advocate, or even as obviously as CSO of Genome Canada?
Yes, well, you touch, a very sensitive topic there, Lester, because that's something I have been, in a way, working on as CSO at Genome Canada for a while, and even at Genome BC and Genome Quebec, trying to work with international organizations to really just promote and support having more diversity in just genomic data sets, because most of the genomic data sets internationally are about 90% Caucasian populations, white Caucasian populations from North America, Europe. Those are the prominent or predominant samples that are in those international databases. So genomics, as I say, has a diversity problem, and that diversity problem really translates into, not being able to develop proper diagnosis for people that are from other ethnicities, not able to guide the treatment for people that are from other ethnic groups, minorities, and so on. So that has been my passion already for a while, and now it brings this other dimension with Doris' story, with my own story, with my friends that I have in Colombia, and people that I know diagnosed with breast cancer in Africa, in South America, and in remote regions in BC, in Canada, that we have an access and an equity challenge with our healthcare system, a big time. And it's not just about genomics, it's about this equity and possibility for access of new technologies and treatments. So that's also something I will continue working and collaborating. And if people that are listening to these podcasts are interested and passionate about it, I am really here to work with you and really join forces. I think there's a lot we need to work, and again, my eyes are now as a patient open really to this new reality that is challenging, but I think it gives us also the opportunity to make a difference. I think we have the opportunity to really help increase access, and in particular, of course, my passion, genomics. I just can't imagine, and you know I can accept, I would say, I can imagine, yes, I can accept that now we have this amazing technology that only a handful of people living in big cities will have access directly. So I think it's important to be able to show that, we can give access to the healthcare, and we can give access to these new technologies to people around the world, and in remote regions and resource limited regions in Canada, as well as around the globe.